Hello, I'm Deborah Chieli, a nationally board certified nurse practitioner with specialty certification in lifestyle medicine.
And I'm Susie Spell, a nationally board certified nurse practitioner, also certified in lifestyle medicine.
The following interview was part of a series that informed our presentation at the 2023 Annual Conference of the American College of Lifestyle Medicine, ACLM, titled Nurses in Action, How Nurses Operationalize Lifestyle Medicine in Modern Settings, and You Can Too.
In this series, nurses from diverse backgrounds and practice settings and their champions tell their personal and professional stories about discovering lifestyle medicine and how they're implementing it across a wide range of settings.
Nurses are the largest health profession in the United States and globally, and have been voted the most trusted profession here in the U.S. for over 20 years. Learning about and incorporating the pillars of lifestyle medicine fosters full scope of practice and the ability to answer the call to lead by the National Academy of Medicine with their report, Future of Nursing 2020 to 2030, Charting a Path to Achieve Health Equity.
We hope these stories of success will inspire conversation and drive creative solutions to better address inequities in healthcare. Continued growth of nursing expertise in lifestyle medicine will expedite our nation's ability to address the public health emergency of chronic lifestyle diseases we currently face.
The power of nurses to create innovative solutions when combined with the practice of lifestyle medicine allows nurses to express their full potential while simultaneously addressing the salient issues of health equity, the epidemic of chronic disease, and the provision of truly patient-centered whole-person care.
When nurses are empowered to lead with an interdisciplinary and multi-sector practice, they answer the call of the National Academy of Medicine to dissolve barriers to care and improve health for themselves, the nation, and every global citizen. Enjoy the interview.
Hello, today we're talking with Karen Kornick, RN, with a master's in curriculum instruction in nursing and in health education. Karen is also a certified school nurse. Karen has been a leader in bringing lifestyle medicine education to the children, families, and communities of Chicagoland area schools for almost 3 decades. She recently retired to Fort Collins, Colorado, June of this year, 2023, after over 28 years of service to the Northbrook School District. And within months of retirement, Karen is thinking about how she can help accelerate evidence-based health education for children and families. Karen's life mission has been and still is to inspire people to live a healthy lifestyle and to support them on their journey in making health-conscious choices. She is a plant-based nutrition coach with over 35 years of experience in health and wellness as a nurse, plant-based nutrition coach, and health educator. She has taught countless plant-based cooking classes, including sessions for middle school students to empower and educate future generations. Karen meets people where they're at by helping them adjust their own habits to healthier choices, and she believes in a holistic approach that integrates the mind, body, and soul to find personal balance. Karen's passion, wisdom, and insight into children's and family health will serve to inspire all of us today. Welcome, Karen Kornick. We are so thrilled to be with you today.
I'm excited to be here. Thank you for having me.
Thank you. And we're so glad you're here. So we always love to start with your origin story in nursing and then how you found and became an expert in plant-based nutrition and lifestyle medicine.
Okay, so I started out in nursing. I've always loved working with kids. So I started out working in pediatrics. And so I worked in a hospital, worked in offices. So I've always dealt with kids and families. And then I became a certified school nurse, worked at a school in a school district in Northbrook for, like I said, for almost 3 decades and really enjoyed it, but wanted to do more. And then I decided to pursue a degree in health education. And because I thought that's how I could really make a difference and be in the classroom as well. So I was the district nurse. And then I also taught health classes. So I did both. And I think that's to get your health education degree is really a key. I know a lot of nurses were busy enough, but I do think getting that extra step, or you could work, if you're working in the school, to work in alliance, work along with the health teacher. So then you could work together. So either way could work, but I had the most independence working in the classroom with the kids directly. And what happened is I was looking years ago, I was looking I was just looking online for healthier recipes and whatnot. And then I found a meetup group. And this was in the like 2000, around 2014. They were doing it was a meetup group about being vegan and no oil, plant-based, no oil cooking. And so I just decided to go to it because I always like to learn more. And every person there was trying to cure themselves of reverse a disease. Somebody had cancer, heart disease, type 2 diabetes. So all these different health conditions. I didn't have anything. I'm all about prevention. So I just wanted to learn more. By the time I left, they made me a co-organizer of the group. And so I just dived right in and started eliminating all these foods from our house. My husband was like, okay, you wanted me to pick up Portillo's on the way home? And I said, nope, we're done. So was my journey of starting the plant-based nutrition. I felt like I was being lied to by the dairy industry and all these different industries. You think raising your kids that milk is so good for them and all the health benefits, because working in a school, that's what you get. You get the information. That's what health teachers do from the USDA. So you're getting with the food guide pyramid, then it became My Plate, but it's all, after you learn about all that, it's all being paid by different industries to get their part of the puzzle, and they want you to teach it their way. So when I did get into the classroom, I decided to do it my way. So I taught it the way that I told the students about what we're told to believe. But then I told them that this is based on scientific research. And so I let them have both sides. But there was a challenging part because I wanted to bring in the person who started that meetup group. She was a survivor she had heart disease, she had a heart operation, completely changed her whole lifestyle, a way of eating, and just her whole way of living. And I wanted to bring her in as a success story for the kids to hear. And I was given pushback with that because the administrators felt like they didn't hear. I don't know what the other side of the story is, somebody who continued to live and follow the sad diet. And so I wasn't able to bring her in, but I did talk to the students. And the other challenge was talking about how dairy is not as healthy as you think it is. And then kids were going home and saying they didn't want to drink milk. They wanted to have alternatives. And some parents did call the principal. And I did get called down to the principal's office, but I explained to them that this is all research-based, and they let me continue on. So I did have support of the administrators, even though I did get some pushback. And so now I think it's a little bit easier because now it is out there more. But yeah, so then I started and this is also something that people could do. I started an elective class called Teen Iron Chef. And it was all healthy eating. So it was an actual class that people have practical, hands-on learning out how to cook. And I think that's something that's really important. And I know that schools are letting go of cooking programs. And most of them are just like box foods. They're not cooking from scratch and learning how to incorporate some plant-based eating into I'm not trying to make everybody plant-based, but at least lean towards it and learn about it, because I think that's a big factor. I thought having that program in place was very popular, and then they changed it. Schools are all about the STEM, so then they didn't want the cooking classes anymore. So a lot of schools are doing away with that, and that really needs to be brought in. If you want people to eat healthier, you got to teach them hands-on.
Karen, that was amazing, and it sounds like, number one, you were able to work with people in the administration. There were challenges, but you were very creative in explaining things and bringing in programming like the cooking that is not only teaching the students about their health, but also basic skills about how to prepare the food and feed themselves. Thank you for that. And that's so needed. May I circle back with that and ask about a little bit about your colleagues and the level of acceptance or support or encouragement you might have found among your colleagues on faculty, because now you're both the school nurse and you are going in and teaching as a member of the faculty.
They were very accepting, and they all knew who I feel like I was a role model because I, walked around with my green smoothies, and they saw that I walked the walk and talked, that I did everything that I talked about. And so they all knew that. Whenever there was any type of staff luncheons, I always made sure that it was well represented, that because before it was always just like pizza or something. It was something I made sure that there was other plant-based foods that were in there, and they were very accepting. In fact, one of my colleagues actually just recently became plant-based, and she feels so much better, and she lost weight, and she really feels so much better. She was having some symptoms and some lifestyle symptoms, and she feels a lot better. And yeah, I think if you could just help even one person, there'll be a ripple effect.
Thank you. And we know you've helped a lot more than that one person there. Multiply it out with all those ripples. Can we dig in a little bit more about how you incorporate the lifestyle medicine, the plant-based nutrition, and address that, say, in that health class, in terms of that curriculum that needs to be covered for the health education classes, and then in the nurses' clinic where you are seeing students for wellness checks, a lot of the things that the school nurses cover, their immunizations and all, but also when they're not feeling so well, and you have those personal relations with those children that are coming through your door.
Yes. It's the best thing about if you teach a class that's outside of the health office, they're able to see the connection. So when they come to the nurse's office complaining of stomach aches, they know I'm going to ask them what they ate and how does that impact how they're feeling. So I think it's really good even if you're not teaching a health class, to do like an after school club, something that you could connect with the students, so you're not just taking a temperature and sending them back, that there's some connection to their health. And as far as the health classes, I actually created the curriculum for the nutrition and all that. I had to create it myself, because if you go online and you get it, it's just going to be geared towards what the USDA wants you to give. I remember those dairy posters that just got milk. Everybody was hanging them up. I actually took them down. I told him, it's just got broccoli. We need to do a new movement because milk is not the answer. Yeah. And then teaching classes, incorporating, I don't know, you've heard of the blue zones, or parts of the world where people are living longer but healthier. The most healthier centenarians in the world. So I had them do group projects about the blue zones. And you don't necessarily have to be a health class. It could be like a history class, and kind of combine those two. I think but it has to be, the administration has to be open to it. And you have to have people that are all for this and see the positive effects, especially during COVID. I thought, wow, learning how to cook and all of this, that would have been the perfect time, and seeing the connection between our immune system. And COVID was all about the immune system and keeping ourselves healthier. So not only with the plant-based eating, I also started a Zen room for the people's mental health. So we started that. Unfortunately, by the time I left, I think they needed to have the room for something else, but it was good. And I think students and staff, everyone needs a time, a place that they could just relax. Yeah, so it's all connected. The mental health, as with the physical health, it's just all connected. And if kids aren't eating well, and staff, everybody is just so busy, they're not gonna do well. Not gonna be able to focus, and yeah.
That's really beautiful. And yes, just tell us briefly about the Zen room. That is just so wonderful. You got a Zen room in the school.
Yeah. I was learning a lot about mindfulness, and I incorporated that into the health classes as well. And we'd start the class with a few moments of just, I did the bowl and just the singing bowl and just had it then a few minutes. So then I thought it would be a good place also for the staff. So we did actually, during that short period of time, we did have a room available. And I just decorated it with tapestries, and then the administration brought in some stuff, and it was good. It was really nice. Yeah. Even if you just have a few minutes, and there's no cell phones allowed in that room. So it was just a zoning out room, and it was good. But I think the students needed it too. And I know some schools have it. And I think I'm for both staff and students, it's really important to have that.
Wow. So much of what you talk about, Karen, is this connectedness. It's all connected in terms of our stress and mental health and physical health and the diet, and you have a stomach ache and don't feel well. Let's talk about what have you been eating, and connecting, helping your students make those connections themselves, connecting with your administration, connecting with colleagues, being the example, just walking the walk and just quietly being the example, and the power of attraction. And then really having that insight to know that if I see those students in a class about health, or if I weave it into a history program, or if I see them in an after school program that's geared toward health, then when they come to see me as the school nurse, I have that grounding, and they are already thinking, oh, Mrs. Kornick, and let's see what's connected here about what I ate, or staying up too late with the TV, or all of that, or not moving, just sitting there eating my popcorn or whatever. Thank you, building connections. I'm going to turn it over here. Susie, would you like to continue our conversation? Beautiful conversation here. Karen, thank you.
Sure. We have this little list of questions, but as you were talking, I was wondering, I know you said at one point maybe you're at multiple schools, but can you tell us about the differences of working with the different ages and how you might change your approach? Or was your program mostly in an elementary or a middle school? Did you say middle school?
Yeah, so I taught health education in the middle school, but I started out working in the district in the younger grades, like K through 3. And so I didn't have an actual health class. Sometimes they invited me into the classroom to talk about certain topics, which is all, you could always be invited in. You don't need a health education degree to be invited into the classroom for one, just as a speaker. But I wanted to eventually just have my own class, but then you do have to have a degree. So just going into where the kids were eating their lunch, I was handing out stickers in the K through 3 building if they were eating fruits or vegetables. And so they got excited about that. So then they would say, "Are you coming today?" I said, "No, it's a surprise." So that you eat it every day. And then it's just, so they love that. So just trying, then going into, like I said, getting invited, asked to get invited into the classroom. And so even if you're doing a talk about how to take care of your teeth, which they do that during dental month, you can include the eating part, the healthy eating part. So there's always creative ways to get to the kids.
Yes. And a couple of questions I had from that, which is, can people from the community come in and talk with the kids too? Because I'm just wondering, as someone who's not a school nurse, but know the importance of that, and I have my roots in pediatric nursing. So is it good to develop those relationships and see if you can't be invited in or ask for an invitation even?
I would go online and find the local health teacher and just tell her your background, and if they need anybody to come in as a speaker. Even the science classes, they'll tie it into the human body as well. So either the science or the health teacher, and some PE teachers as well. Some PE teachers are the health teachers. So it depends on the school. You can look and see who's teaching what and start from there. They're always looking for speakers that has a good background.
Yeah, that's great. I'm wondering as you're talking, because I'm not really in the pediatrics world so much anymore, especially I know the American College of Lifestyle Medicine has a lot of member interest groups. I would attend all of them if I could. But you're talking about having developed curriculum and probably numerous things over the years. Do you know if any kind of like school nurse toolkit exists, whether it's in the American College of Lifestyle Medicine or outside of that? Does something exist where if school nurses were interested in this, or they hear this at some point, if they say, oh, I wonder, has someone put this information together for me to take it and then adapt it for themselves?
Not that I know of. It's more under the health teacher when you're looking for health teaching, but I'd be happy to, if anybody wants to reach out to me, I'd be happy to give them some curriculum depending on what they need. If it's just like they just want to do this one certain lesson, or if it's multiple lessons, I'd be happy to share what I have.
Yeah, that's amazing. I was talking with Dr. Megan Grega up in, I think she's in Pennsylvania, and she
Hmm.
does a lot within the school district and in the schools there, and talked a lot about that. And a couple of other people I've talked to, we thought we need to develop something for schools. But of course, we're not in that world necessarily. So I think that would be a fantastic opportunity or project, side project.
Yeah, no, I'd be happy to do that. I think the earlier they start them out in kindergarten, it should really be built in every year. And this has been my thing. I don't understand why other subjects are built in every year, but for health, it's only in middle school. And we didn't even have it every year. My middle school only had it for 2 years, like the sixth and eighth grade. And then in high school for 1 year for one semester actually in high school. So they get very little health education in schools, and that's something that you definitely need. Doesn't matter what career you go into, you need it for your own personal life.
Yes, absolutely. And I would imagine that even the PE teachers, like you talked about, are probably a key piece or partner. I was talking with one of the PE teachers because I work in a school district, but I just see them as patients in a primary care clinic. And she was talking about Gatorade gives a lot of money and Gatorade. So I think those partnerships that schools have, they depend on them. So have you ever come across that or had to address that in any way in your school?
Oh yes, absolutely. The vending machines. Oh yeah, that was a big fight years ago. I said no, I cannot. We can't have all these sugary drinks, and I yeah. So I did the best I can with that, and we did eliminate a lot of stuff.
Right. What about being able to navigate like a bigger picture of diverse opinions, of the diversity of people that exist, the kinds of different families that are around? I'm sure in the Chicago area, you probably had a big diverse set of people that have their own cultural norms and religious beliefs and ways of eating. How did you address any of that kind of thing in your school, the diversity piece?
In my classes, or yeah, it was definitely in my classes. I We addressed it on whatever they're eating. You could still eat the healthier. You still keep with your culture. We wanted them to keep with their culture. They should. In fact, those are the better foods. So we were able to talk about that and how they can make it healthier versions of that. Yeah, so it was definitely addressed.
We seem to feel that the diet piece is the biggest hot button topic when it comes to the lifestyle medicine pillars. There's always so much emotion involved in that. And of course, I'm sure there's a diverse array of opinions within the school board and everything like that. But it sounds like you, at least from the get go, had support from, I think it was the administrators at your school, at least, who helped you.
Did, because if you just bring them the scientific background and let them know that there's research behind it, and that they all know that the food guide pyramid seems to be ingrained in their head, and the fact that they're giving milk every day for free, but yes, they're paying minimal amount, maybe $5 for the year because it's all funded. I go, why aren't we having alternatives in the schools? That's a problem because there's nobody funding it. So I always had a problem with that.
Yeah, I imagine that would be an ongoing challenge or area of opportunity. What's your perception of how this has all changed in the 28 years that you were there? I'm sure we see even in our culture, I call it pop culture, right? We even see Dunkin' Donuts has something plant based on their menu. It's becoming much more prominent and out there in social media. So what's your perception of how people have changed in those almost 3 decades in terms of nutrition, but also the other pillars that we talk about in lifestyle medicine?
Oh, I think it's definitely more on the forefront. People are now seeing that there is a connection because it's talked about, like you said, it's everywhere you go. It's plant based, even though a lot of it isn't as healthy. A lot of processed plant based, but that's what they need to learn about, how to differentiate what's healthy and what's not. But I don't think I think it's a little bit easier. And the nurses and health educators now bringing it in than before, and to see the connection with what they're eating and their mental health and their sleeping and all of those different lifestyle measures, because it's all connected. And I think it's much easier now. And I think COVID actually, I would think, brought it to light as well.
Mm-hmm. Yep, I agree. And so, to your point about being able to decipher marketing messages, because that was a big thing. There was some legislation passed at some point. I don't remember the years, but some time ago about marketing to children. I think the tobacco industry first and then the food industry. So, was that part of your curriculum too, of how to read labels or decipher the marketing tactic?
100%. 100%. And it's not only kids, adults don't know how to read labels either. They'll say, oh, that's healthy because it says it's got all the buzzwords. It's keto, vegan, this, that, gluten free. It's all of that. I go, but did you look at the ingredients? People will come up to me and they go, oh, I can't read it. Yeah, they do make it very small, but it's the ingredients. So I brought in a bunch of labels, and that was another group project that they all looked at the labels. They had to figure out what's healthy and put it in order, and then how to make it healthier, what other choices. So we did a lot with food labels. I think that's the most important thing, to figure out what's healthy and what's not. Of course, if you just pick up the produce, you don't even have to read it. But yes, they do need to learn how. That's the most important thing.
Right. It is really important. What about any stories of success that you've had with any students or even colleagues changing their health?
That one cow, she completely changed her lifestyle like about 5 years ago. And so she's completely plant based and she feels fantastic. She has way more energy than she had before. Her menopausal symptoms have gone away. So she's doing a lot better. Kids have come back to me after they graduated, and then they come back. A few of them have come back after college and said how that they have incorporated some plant-based eating. They watched, their whole family sat down and watched Forks Over Knives, and that made a huge difference. And so I have heard and seen. And I think some people, they just don't like to talk about it. They'll be doing things, but they don't talk about it as much.
Can you comment a little bit on how to understand or operationalize or work to the top of your scope as a nurse? Because, like we said, nutrition is one of the hot button topics just in general. But we also have dietitians, maybe not in school as much. Maybe you don't not may not be up against that as much as somebody else, like let's say in a hospital where there are dietitians, and there's so many nurses, and we need our dietitians, right? We need to partner together. What would you say about your scope as a registered nurse in a school talking about food? Any comments that you can make about that?
Yeah, there aren't. Yeah, I wish I could say something positive, because I do think it's important to have that partnership. But in the school, so the only dietitians that I have had any talkings with, it would be if you have students with diabetes. So then I had to call up and maybe make some adjustments to what they're eating and whatnot. But I didn't really have the control, or I didn't really have any type of ownership with that. It was just them talking about me with student with the diabetes. And yeah, unless because they're trained under the USDA guidelines as well. So unless they're a plant-based dietitian, we're not going to get the guy. It's not going to match up. This is not going to match up, unfortunately. All the dietitians are not on the same page, because they all went through that one model.
Which I feel like that's the same across nursing and physicians and PAs. I think it's across the board, right?
Yes, physicians, yeah, absolutely. Unless you get your own integrative, holistic training, you're going to be under the same, and it's not their fault. It's just the way schooling is. They need to integrate the lifestyle medicine to all programs. so that we could all work together and be on the
Right.
same
But
page.
clearly you have a command of the knowledge, you're an expert with it, and feel very comfortable in your role as a registered nurse talking about it. Is what it seems like to me.
Yeah, I'm very comfortable, and I don't mind being the one that doesn't agree with everyone.
That's a
I'm okay with
yeah, that's a good perspective to have, that it's okay to feel uncomfortable that way.
that. Right. It is okay. It's definitely okay. And I like to hear their point of view. And I've worked with some staff members that, like this one staff member said, Karen, I want to lower my cholesterol. My doctor wants to put me on medicine. I'm willing to try it with food. I said, yes. So I told him what to do, and I gave him my cell phone number. He's at the store. What should I get? And he literally did lower it. But then I come back the following year, and he was on medicine because he said he doesn't want to stick to the changes. Like it was too difficult. So yeah, that was kind of sad.
Yeah, there's definitely the behavior change is a huge issue. The other thing is if we can capture children from a young age also and get them interested, maybe they would get their parents interested.
Absolutely.
And
Absolutely. And I think the program, like you said, and I agree, it needs to start at a younger age. It needs to start at even pre-kindergarten.
my son was, well, and my daughter too, they were in a Montessori program for a little bit, and they used to they would have to be, they had a kitchen area, and they would actually sometimes make little food plates and tea and water, and it was just really cute. So they were at least testing that out. And I didn't have all the knowledge then that I have now. So I don't really remember all the things that they were doing or eating, but I do know that they were building kitchen skills specifically within that curriculum. So that was really nice.
Yeah. And when I was in the elementary building, I remember bringing in different vegetables and fruits. Like a lot of them, a lot of kids aren't even eating hardly any. They'll just eat like a certain ones, like corn or potato. Like they don't eat the variety. And just learning about what it is and creating like even the dips and sauces, put it in, and it's delicious. And then they start eating it. And actually, I think another thing is gardens, community gardens. If they're growing it, they're going to eat it. They'll have fun creating with that. So if it in my dream world of of a
Well,
school,
maybe each school could have their own garden.
that would be amazing. That would be
Yeah.
amazing.
Actually, there's a woman in my area who went through the T. Colin Campbell plant-based nutrition curriculum like you did, and was running vegan after school programs. And she really tried to get the schools to have gardens. And she said they'd start growing something, and then she'd go back and she'd see that whoever was there they spray the playgrounds and all of that, and they had just doused their garden with and she was like, oh no. So having other people involved with those efforts, I think, is important in the school,
Absolutely.
and the other parents, and like engaging
Yes.
all the people.
Absolutely. Everyone has to be on board, and they have to see what a difference it would make.
Yes, yeah, true. Do you have any tips for us about navigating the multiple levels of stakeholders in this whole area of lifestyle medicine within a school, from families and individuals all the way up to the policy level, really?
Yeah, I haven't gotten up to the policy level, which I probably should because I was thinking that would be the next step. Since I'm not in the school district anymore, on that actually maybe that'll make a difference. But I think you can at least start with yes, that is something I would love to do. But working with your administrators and just talking to the people who are actually influencing the kids, and if you could get on it to the board members as well, that's great as well. Anybody you could talk to in the district that has some say so, partner.
Yes. I think that's a great tip. And when I first started learning all this stuff and I was so excited, I talked with a physician who, because I was having a lot of pushback in my company, and she said, just find a single person who is near the top, who believes in what you're talking about. She's just find one, and then you can make headway. I might shoot it back over to Deborah to talk about the future of nursing, which she did a little bit already. I know we've already been talking for a bit, but maybe we can towards the end of our conversation with the future of nursing report, because it really does shine a light on community health, population health, school nursing, and really an urgent call to action to nurses. So
Thank you, Susie. Switching over to that and what's at stake, I'll read. There's a future, the National Academy of Medicine had a Future of Nursing report 2010 to 2020. And that was calling on how we can support nurses. Now, the newest report is 2020 to 2030, and it is charting a path to achieve health equity. It is informed by COVID and what it pulled back the curtains and shone a light on the social determinants of health and the great, enormous health disparities and how groups were so inordinately affected by COVID. So this is it's really becoming part of the healthcare system now, but they are calling, the National Academy and the committee are calling on nurses as uniquely positioned to help lead on this effort because it's the most respected profession, at the bedside, out in the communities, in the schools and always wherever people are, there are nurses. And then also the whole person paradigm. Wanted to ask, I'm going to just refer down here in my notes to a couple of things. This is the National Association of School Nurses Healthy Communities position statement. It said it's the position of the NASN that healthy and safe communities are essential for the optimal health, being, academic success, and lifelong achievement of all school-age youth. Bridging education and healthcare at the registered professional school nurse, hereinafter referred to as the school nurse, is uniquely situated to protect and promote student and community health, to work collaboratively to respond to public and population health needs, and to contribute to building equitable culture of health that places well-being at the center of every life decision and policy. So that is the beautiful, powerful statement by the NASN. And I just wanted to merge. We see this sort of as a Venn diagram. We who are passionate, lifestyle informed nurses and our colleagues. And then the Future of Nursing Committee and the National Academies. And then here, as we studied to prepare for our interview with you, is that beautiful statement about school nurses from the organization. The Future of Nursing report recognizes nurses as catalysts for change and trusted bridge builders. School nurses have certainly been recognized as the bridge builders between education and healthcare in schools. And the report adds that additional levels of complexity, to that role acknowledges that school nurses are the bridge between healthcare, education, community systems, and health equity for our students, our families, and the staff. So really, both NASN and the Future of Nursing, the National Academies, and the committee have positioned school nurses as some of the key bridge builders in all of this. With all the bridge building that you've done and all your really nearly 3 decades of work here in this field, might you just comment on all of that, share about, just feel free to share widely what we need to be doing, what support you need, what opportunities there are, some of the skills and strategies for your successes, that communication, finding the administrator, talking to them, bringing the science. Can you just share widely about connecting those for us?
Yeah, I think any way that you could get the word out. And maybe years ago, I did do a newsletter. I did a health newsletter. So that's also a good way of connecting so they know where the voice is coming from. So any type of, like you said, after school things, anything that you could connect will help strengthen that. But I think the next thing is policies. I think that is the next step. And just that the connecting, like I said, with the administration and the board members and letting them see that you're actually doing something, doing the after school clubs and doing demonstrations and working with the parent teacher organizations in the school as well, because they'll do like fundraisers, they'll do like races. You could connect with them and work together. I think any way that you could work together with any organizations that connects the parents, the staff, and the students will bring it all together. and get the word out.
Those are some great tools, the newsletter and the parent teacher organization. And even you mentioned they're always needing to fundraise because they're bringing in funds for those supplies for the classrooms, for the sports and all. And boy, I was just visioning that as you were talking, and I thought that whether it be offering a donation to the PTO, and then they'd be able to attend in the gymnasium or in the teaching kitchen, a teaching class with you. And it would be all about this.
Yeah, inviting them in, which I've done that. And I've done a health fair in the past too. So you have different stations and you could have the students there and then the parents come in, how to take your blood pressure and then with how do foods impact you. So the whole thing is just all lifestyle medicine. And so you could do that in a health fair. So that's another good way of bringing everybody. And then everybody sees the importance. I brought in the board members, I brought in the superintendents. So you bring everybody in, any way that you could bring everybody in to see what you're doing and see how it impacts the students is key as well.
That's wonderful. Thank you. And including you really are highlighting bringing those students in and letting them help or demonstrate and participate in all of that, own all of that, and be their own agents from what you're teaching them. Read your labels and understand, be able to cook in the kitchen so you can have that confidence so they can have that autonomy to make those decisions. And then in those health fairs that they're engaged, they can even, coming out of your classes, they can even be the experts in some of those and helping demonstrate things and all. It sounds like on so many levels, bringing the messages, bringing people together, bringing them in, connecting all of these. And it also sounds like you're presenting some really fun, beautiful, and creative, as Susie was touching on, some really beautiful ideas that the lifestyle medicine community could be supporting school nurses here with those tools. As Susie captured when you talked about your curriculum, what's happening with that curriculum? Where's that sitting right now? Is anybody using it? And might we use that to help develop out of our lifestyle medicine, part of what we're trying to do here? And I'll let Susie is anxious to jump in. We're both so excited about bringing things forward, like this is just the beginning of this is just another series of conversations, as you talk about, Karen, bringing people together, people from the future of nursing, from the committee, school nursing, lifestyle nursing. And because sometimes the school nurses they're always doing this beautiful work, but maybe they didn't see forks over knives, or they don't know some of the science, and they don't have this kind of access to this kind of curriculum that we would be able to be. So I think one of the interviews, they talked about infecting. I don't know if that's Karen Lang, but but I think it's like how to have this impact on all these levels in different spaces and among different groups and bring people together. Yeah. That's easy.
I was thinking of I may just start my local library even and just have a showing of forks over knives and then a Q&A at the end, just as a starting thing to get people understanding what that's all about. That movie is older and it's still a lot of people don't know anything about it.
Can I ask you a question really quickly? It just popped in my mind when you were talking, which is when you were talking about all the different things that you've done. Have you ever worked with pediatricians in your area or anybody in the medical establishment outside of the school?
Yeah, not directly. And I think that would be very helpful. But I think if we brought them in, that would definitely offer more credibility. For some reason, they really listen to doctors more. So I think having that partnership and going into the school would actually be really good.
Yeah, I remember because I'm sure you did too, worked at a very busy pediatrics practice. They're so busy.
So busy, yeah.
Maybe they would like somebody to help carry the weight of a healthy lifestyle.
Yeah, because there's lots of opportunities.
There are so many.
Thank you, Susie. We always love to circle back, Karen, to you and some questions about any other specific advice for moving this forward. Talked about policy and just opening up to say any further any advice for moving this forward, coming together, who else we could bring to the table, tools. You've mentioned so many things we're taking notes on. And then beyond that, if you had a magic wand, what might we be doing?
Oh, the magic wand would be starting out as young as possible to teach all of this healthy lifestyle, starting out in pre-K, and then every year it should be taught. So that's what I'd like to work on, trying to get that into local policymakers, and so with the show them the importance of it, that it needs to be taught every year, just like all the other subjects. It's not less important than science and math and history. It needs to be. So this is something that they need to live. And so that's my magic wand, would be starting it at pre-K all the way up.
I would argue that it is science.
It is science.
It should be part of STEM, science. Right?
Yes, 100%. Science is, it's how your body works. And so when I taught health, I actually did combine it, because you have to learn about your body, and then how does that impact your body? So I had to bring it in. And nurses all have science background, so it goes together. Absolutely.
Anything else you would like to share about anything that we've spoken about, or other things that are part of your life? We really asked you to hone in on this amazing role as a school nurse, but other ways that you are embodying this moving part of your life about helping people become healthier.
I learned how to sprout foods. During the COVID, I learned how to make my own kombucha. So sprouting, fermenting, learning about gut health. So that's something that I'd like to get out there more, the gut health connection. That's my passion too, to teach people about that. Doing yoga and things like that. So I'm having fun doing all that, but I really want to do more with teaching outside of the school, or helping people that are in the school as well. I'd be a resource for that. So whichever way that I can help.
That's so beautiful, that the things that are inspiring you, it's like, that's wonderful and I love it, but it's only partway there until I get to share it with others and inspire and educate and empower others. It emanates from you, from your heart, Karen. And I think that I both feel in being with you here today that one part of the many parts of your success, in addition to your expertise and your lifelong learning, your curiosity, is this very down to earth approach that when you are speaking to people with all of your expertise, there's no judgment. There's just kindness and compassion, and sort of it's just very matter of fact. I don't know, might not be the best way, but it's not all the emotion. It makes it a safe place to have a conversation, that it's not high pitched, and it's very comfortable. I think I learn a lot from listening to how you express these conversations and relationships and discussions, and the way you've approached so many of these and created so many opportunities for learning and interconnecting the learning.
Thank you. I appreciate that.
And we have to really recognize here, this is a challenging environment to be a school nurse. This is really, when we talk about the front lines, we're talking about the front lines, not just at the bedside in acute care, which is certainly the front lines in coming through COVID, but this is frontline nursing here and in our schools.
And I know one of the challenges we have in our district, in my district here, is we have one RN for 5 schools, which makes it very difficult for them to do all the things that I'm sure that they want to do, which is why building those ambassadors at the different schools would be nice.
Yeah, the reality is there's many school districts with one nurse for multiple schools. I was very lucky. I worked in a school that had one nurse per school. And yeah, I was very fortunate, but not everybody is. So I recognize those challenges, and you just have to do the best you can in that scenario.
Thank you so much for this. This was really nice. You're our first school nurse. And we know that it's such an important place. You're essentially in the community. You're in the community with people and can have a huge impact. So I think it's so important. And just like the Future of Nursing report recognizes that school nursing and community and public health and population health nursing has been so undervalued and underpaid, and that there's a call to action to
Yeah,
change that.
I appreciate this opportunity. So thank you very much. It was great talking. Oh,
Yes, you're welcome.